In late 2021, the small community of Hope faced a challenge: a need for specialized education for its hospital's emergency department nurses amid a high vacancy rate. A visionary team of Fraser Health staff came together to create the Rural Emergency Competency Education Pathway, or ESEP.
At the time, Fraser Canyon had a huge vacancy rate, and they had an influx of hires. They had 12 new nurses that started, and the current pathway for education, which would have been either BCIT or ESEP Phase 1, it would have taken over 3 years to get all of those new nurses educated and come out on the other end. They needed something unique and different in order to keep operations going and to keep the competencies going for their nurses to provide safe patient care to the emergency patients that came in for their community.
We were really looking at the need of being able to support emergency practice within Fraser Canyon Hospital without pulling the nurses out of the site to do training, which would be a traditional approach to how we would provide education. We wanted to create a safe space for people to learn and develop their practice there, so we brought the program to Fraser Canyon Hospital, which was super exciting and unique.
Just to be a part of such an innovative way to bring education to our staff is so important. And so super excited for them. They are feeling way more confident. Just the feedback from the physicians that are working alongside the RNs is phenomenal. They're just really excited to be a part of that education for them, because they as well will gain knowledge from our RNs, because they work together so collaboratively as a team in any trauma situations, just to develop the care planning for each individual patient that comes across.
Having this program ensured that everyone got trained to the same level and that we were able to speak the same language and could really trust that everyone knew what they were doing in a stressful situation. It's really important to have that trust. We do not have the same resources as a lot of the big hospitals have. And so having the education tailored specific to us really allowed us to utilize the resources that we do have on site to provide the best care possible to the patients.
I could not be prouder of being part of the work here at Fraser Canyon, and specifically this training program, because it really, I do think it's the way of the future, where we bring the education to the staff in the environment that they're working in and empower them to do the job they want to do. Giving our nurses the skill set they need to respond in an emergency has totally impacted patient care, because now they have the confidence, they can jump in, they can, respond appropriately. Our patients deserve the best care, but our staff, they go above and beyond every day. So that inspires me to go above and beyond every day, to make sure I'm doing what I can to support them to do the great job they do.
Congratulations to the Fraser Canyon Hospital Rural Emergency Competency Education Pathway Program, the recipient of this year's Innovator Award.